My name is Gabriella Gobbi. I'm a psychiatrist. I work at the McGill University Health Center, so I see patients mostly with depression, as well as I'm a scientist and I direct a laboratory of basic research in psychopharmacology. Okay, one of the first discovery we did is that THC or CB1 agonist, the agonist of the receptor of cannabis, low doses increase serotonin. So for this reason you have the sensation of euphoria, of high, because serotonin is the neurotransmitter implicated in depression and mood regulation. But at higher doses and THC or cannabinoids decrease serotonin. So actually you can produce depression or maybe also a psychotic state. Similarly, later we also discovered that in particular in adolescents, the chronic use of cannabis can decrease the neurotransmission of serotonin, leading to anhedonia, that is the lack of pleasure, depressive symptoms, and some also anxiety. But I would like to point out that people think that you develop psychosis only if you have a family history. No, it's not true. We know from epidemiological study done in thousand people that cannabis, even in people that has not a previous predisposition for depression or psychosis, can actually develop depression or psychosis. So we know that cannabis is very bad for mental health. Okay, at the best of my knowledge, I haven't seen still the study on perception of cannabis by young people, but I know quite well the statistics from Colorado that have legalized cannabis several years ago. And we know from this data that the perception of cannabis in adolescent and young people has been trivialized. So young people think that cannabis is legal, so is harmless, but actually it's not like that. So we have data from Canada. So what we have saw in the last year is that the consumption in adolescent is still stable, go from 17–20%, even if in Canada cannabis under 18 is illegal. So it means even if you have the law that cannabis is illegal for young people still smoke cannabis. So the things that has changed in Canada a lot is the population of late 20, 25, 35. Before the legalization, this population was 7%, so quite small. Now, after the legalization, 24%. So it's really impressive. So we have all this population of adults between 25, 35, 40 years old in which the consumption has been increased. Yes, we have not so many studies. There is a recent study published in the UK in which I've seen if you start to smoke cannabis after 27, but you start after 27, the risk, for example, depression is more moderate. But the problem is that very often people that start smoke cannabis late is because also they start earlier. So it's very difficult to distinguish only the population that start to smoke cannabis at 27 plus or 30 plus. Okay, first of all, nobody talk about the dosage of cannabis. We know that cannabis high concentration, as today we can find in Canada, 30%, 22%, is very dangerous, can produce psychosis in everybody. So the first thing is to consume cannabis at low level of THC. That means less than 3% or less than 1%. In fact, some countries, as Switzerland, have legalized only THC with very low concentration, 1%. Instead, I repeat, in Canada, you can buy 30%, that is enormous. And also the quantity. So the quantity has to be moderate. We know that even one joint a week can be a lot, because the secret of cannabis is that stay in the brain, stay in the body for 1 week, 2 weeks or more. So even if you think that you smoke, you don't smoke too much because you have only one joint a week, actually it's a lot for the brain. So I think one problem is the moderation of THC, the quantity. Second, also to have a joint with more cannabidiol, because the cannabidiol looks more protective for the brain. And this, I think, my major recommendation. And also, yeah, to be very careful in the environment where you smoke cannabis, because also the environment can influence the effect of cannabis on your brain. Good question. This is one of the difficulties that I have with my patients. Because people come to see me, I ask, is cannabis problematic for you? And the patient says, no, it's not problematic because I can smoke only 1 time a week. Yeah, but 1 time a week is not enough to see if you have dependence, because again, cannabis stays in the brain, in the body for 1 week or plus. But try to stop for 1 month, and let's see if you have the craving for cannabis. Let's see if you become agitated. Let's see if you develop all the symptoms of withdrawal, that is as irritability, lack of sleep, nightmare, anxiety, agitation, nausea, change in weight. These are the symptoms of cannabis withdrawal. So if a person, for example, doesn't smoke for 1 month and then start to notice these changes, probably has a problematic use of cannabis. It's very difficult for the doctor and also for the patient to understand when it becomes problematic. Often, for example, the patient that smoke every day come to see us and say, I feel depressed, I feel apathic, I don't know what to do in my life, I don't know if I want to continue to go to university or I want to find a job. This kind of anhedonia, lack of pleasure, indecisiveness, incapacity to see, to look forward. This is, for example, is one of the symptoms of cannabis, but it's very, very problematic. It's very difficult to understand for the patient and for the doctor. Yeah, it's not easy to distinguish between a bad trip and psychosis. Okay, normally the bad trip is when a person, after smoke a joint, start to have some paranoid ideas, start to see the friend as if want to harm himself or herself, but the person is still in contact with the reality. The person is still inside judgment. He or she understands that these paranoid ideas is because just smoke. So this is a bad trip. So the psychosis is when the person lost the sense of the reality, is not anymore critical, is lost, has no more inside the judgment. So he start to have a very paranoid delusion, thinks that there is the mafia, the police after him or her, or has a grandiose idea, can jump from the 3rd floor, or just drives very fast on the road. This lack of insight, lack of judgment is characteristic of psychosis. But anyway, chronic cannabis can give a different kind of mental problems. So one of the things more common is to see that the person slowly become depressed, asocial, prefer to stay at home, just to chat on the phone, stay in front of television. So there is the isolation from other people. just stay at home and like to smoke. And sometimes you can have more anxiety, you can have even a panic attack, for example. Or sometimes you can see also real episode of psychosis or paranoia. You can also notice in the people around you.
But often you see like social isolation. Right?
Social isolation, I must say, is one of the most common. But it's very difficult to discern, to understand, because it's not from one day to another. Slowly, the person, a young man, a young woman that was very sociable with a lot of friends, going out every night, become slowly, over 1 year or 2 years, more and more isolated. There's a change of personality, change in mood. Yes, it's very important to ask to see a doctor or to see a psychologist, and also make the person aware of the problem of cannabis. Because again, a lot of people tend to minimize, say, no, it's not cannabis, it's me, it's the circumstances, it's the universities, my teacher. But make the person aware, no, look, you have changed since you started smoking. Look, try to stop for 1 month or more. Let's see what's happened. Let's see if you have withdrawal symptoms. But it takes a long time. Sometimes with my patients, I take even 1 year or 2 years before convincing the person that has to stop. A lot of things. First, that cannabis is dangerous. In particular in during the young development of the brain, until age 21, 25 is still problematic. Be careful about the quantity of cannabis, the concentration of cannabis that you use. It's better to have more cannabidiol concentration than THC. And ask questions if you think that you have some symptoms of mental health. Don't hesitate to talk with your doctor or with your psychologist.